Inflammation. You've probably heard the term used with illnesses such as arthritis or an injury. Inflammation is our body's response to infection, irritation, or some chronic illnesses. But when inflammation strikes the membranes that cover the brain and spinal cord, an illness known as meningitis occurs. Caused by a virus or bacteria, meningitis can be quite severe and, if not quickly treated, can cause permanent brain damage, hearing loss, learning disabilities, or even death. Meningitis is easily spread between people in close living quarters. Often striking teens and college students, the illness is spread through the exchange of respiratory or throat secretions that occur during coughing or sneezing, kissing, or sharing eating utensils. Meningitis comes on quickly. Symptoms strike in as little as several hours or over up to 1 to 2 days. The most common symptoms of meningitis include a sudden high fever, a very bad headache that won't go away, and a stiff neck or back. Other symptoms may include nausea or vomiting, discomfort with bright lights, confusion, or sleepiness. If you suspect you or a loved one might have meningitis, see your healthcare professional right away. Early diagnosis is important to avoid the more severe, long-lasting effects of meningitis. Your healthcare professional may run a rapid test for viral meningitis. Even if the test comes back negative, you or your loved one may have the more severe form of bacterial meningitis. Other testing may be required to determine if you are suffering from this form. If you or your loved one are diagnosed with bacterial meningitis, you may be facing a hospital stay for treatment with intravenous antibiotics. But there is a way to stop this illness before it gets you down. The best way to prevent meningitis is through vaccine. The Centers for Disease Control, or CDC, recommend that all children ages 11 to 18 be vaccinated, usually at their 11 to 12-year checkup. If you have a child about to enter college, check that they've been vaccinated against meningitis. They should be fully vaccinated before starting their freshman year. Meningitis is a preventable disease that can have lifelong, devastating effects if it's not prevented or treated. Speak to your healthcare professional today about vaccination against meningitis.